Today again, we are continuing with the Global Health Series, number 46. And I'm going to talk about Spain and Botswana. My name is Professor Silvanus Okeke. Before we continue, remember, health prevention is the key. How can you prevent yourself from being sick? How and what do you do to live longer than what is expected of you? Would you only rely on the country you are coming from, or what you can do as an individual? Those are key factors you need to really recognize when we are talking of global health. Health prevention is something you need to initiate. A lot of people have diabetes, a lot of people have one thing or the other. They need to take care of these things through their behavior, the things they do. These are things that are very important when we are talking of global health. The life expectancy in Spain is 82 years, and the life expectancy in Botswana is 54 years. I've always told you most countries within the African continent, their life expectancies are so low that you start wondering what is happening. Spain has a life expectancy of 82 years at average because of the social determinants of health. And we are going to consider those two countries, considering the social determinants of health in Spain and social determinants of health in Botswana. And we are going to use the same kind of parameters. The social environment, for instance, in Spain is better than the social environment in Botswana. How people live, how they take care of the environment, those are issues that contribute to people living either longer in life or shorter lives. So the social environment is very important, because a country that keeps their social environment very clean, where people interact very well, where the networking is good, is bound to live longer than a country that does not do that. And that's what you have between these two countries. Then take education, for instance. Education in Spain is better than education in Botswana. And that is where the African leaders are not doing what they are supposed to do, because they are supposed to also train the African people in such a way that they will take care of the environment. When somebody is trained and disciplined, he's likely to live a neater life. A lot of people come up from all those places with tuberculosis and those sicknesses that are gotten from very filthy environments. Whereas in Spain, the people attempt not to do such things. And you see people clamoring to go to Spain to spend their life or to live there. Then take community planning again. The planning in Spain is good. You have people living from Africa, from other places, going to stay there and help them within the planning of the communities, within the planning of the environment. Whereas you don't have such factors in Botswana. All you have is leaders who steal their people's money, and those people want to run away from their country to go and live in other countries. Then workplace in Spain is better, and you see a lot of youth and young people, even from Africa, going to work there in Spain, whereas the workplace in Botswana is not as good as that. And that will surely contribute to the social determinant of how people live. And that is why you have them living 54 years as compared to 82 years in Spain. Then apart from the workplace where people do their work and spend a lot of time, you have the health sector. The healthcare delivery system in Spain is better than that of Botswana. When you compare the two sectors, you have people who have very good healthcare delivery system, who are receiving a lot from their government, from what the policymakers are trying to do, the leaders in the country. So the healthcare delivery system in Spain is better than that of Botswana. So the healthcare delivery system in Botswana needs to be improved upon in order to allow these people to live as long as people in Spain. Then the economy itself is another factor you need to consider. Under social determinants of health, when the economy is bad, when the economy is poor, when there is high inflation, where there are no jobs, people are not working, you don't expect them to live very long. Frustration sets in, stress, all those things. And that is what is happening in Botswana as compared to the economy in Spain, which is better. People there spend much of their life working and working hard, making money, creating a good environment for people to live longer. Then you also consider the policy makers. I have not talked about them as individuals that affect policies and affect the social determinants. I've always been calling them in passing. These are the leaders in these countries who ought to consider what is happening. People in Botswana should ask themselves, why are we living 54 years, whereas people in Spain live for good 82 years? What's the problem? And when the policy makers are up and doing, when the leaders do what they are expected to do, you discover that the people in Spain are not likely going to live longer than the people in Botswana. So policy makers should be held accountable to what is happening in all their countries. The policy makers in Spain are better comparatively. So policy makers in Botswana ought to work harder, ought to do more, ought to lead so as to be able to improve the standard of living of the people, improve the educational system, improve the economy, improve the communities. And once these things are done, the social environment is likely to be improved upon. And with that, the people in Botswana will increase their life expectancy. It will go from 54 to maybe around 60-something if they can't make 80. These are things which the policymakers should influence in all countries. And I urge them to look at these factors. They should look at the social environment. Policymakers should look at the educational system in their country. Leaders in Botswana should look at the workplace and what is happening. They should look at the healthcare delivery system, and finally the economy and why people are living so short lives in Botswana. And once they're able to do this and compare with what is happening in Spain, where the workplace is better, the healthcare delivery system is better, the economy is better in productivity, in employing people, in job creation, and they consider also the educational system that is in Spain, they will be able to equate or match Spain to Botswana and say why Botswana people live shorter lives when compared to the people in Spain. And once that is done, they will be in a position to say, yes, there are things we need to do in order to help our people. There are things we need to do. And that is what leaders are created to do. Once they're able to do that, then the people in Botswana will live as long as people in Spain, or even better. Thank you. That is where we are going to end today. Next day, we are considering Global Health Series number 47. And then remember, I told you that health prevention is the key, and that starts with the individuals. I'll see you again.